According to a new study compiled by US researchers at the University of Washington, the Middle East and North Africa will see a 367% increase of dementia. This is a projection of the increase in cases the region is likely to see in 2050, compared with figures compiled in 2019 just before the pandemic. According to the study published in the medical journal The Lancet, Saudi Arabia will see an increase of 898%, while Qatar, the UAE, and Bahrain will see increases of over 1,000%.
The projections in North Africa and the Middle East were quite large, and this was due to large increases both in population growth and population aging. And so these two demographic factors, in particular in that region, drove these large anticipated increases in dementia burden. So this is really something that governments and policymakers in these countries need to be aware of in terms of planning for the numbers of people with dementia that we anticipate to be living in these places in the future.
Lifestyle plays a big role in the increasing risk of dementia. These include smoking, obesity, and poor diet. The study claims that by 2050, 153 million people are expected to be living with dementia worldwide, increasing from 57 million in 2019. Researchers stated that a good education system is important when it comes to communicating about health messages.
In Europe and the sort of Western world, their response to managing risk factors from a very early age on, we're now starting to see a decrease in the numbers of some dementias, such as vascular dementias. So the sort of health promotion elements of managing risk factors is starting to have an impact. Now, we won't be able to manage, we only know some of the risk factors for dementia. Some dementias will occur through reasons we don't yet fully understand.
In developed nations like the US, Europe, and parts of Asia, doctors have been grappling with aging populations and unhealthy lifestyles for long. And it has enabled governments in these countries to create strategies to tackle the problem.
Healthy diets, lower alcohol intake, stop smoking. So there's this sort of mantra, look after the heart and you'll look after the head. Plus also, there's been great strides in how we manage cardiovascular disease that affects the brain. So stroke management, for example. So, the sort of antithrombolytic agents are being administered much more rapidly. So we're seeing a reduction of the functional damage caused by some of these transient ischemic attacks or strokes. So hence, down line, we're seeing a smaller number of vascular dementias.
Overall, in Western Europe, the number of dementia cases is expected to rise by 74%, from almost 8 million in 2019 to nearly 14 million in 2050.